alkalosis. If base excess is 0, standard base excess is 0, this is acute. You don't have to do any calculation. If base excess is 0 in patient with respiratory acidosis or alkalosis, this is an acute phenomenon. This patient doesn't have chronic. In chronic respiratory and alkalosis, the bicarb should be half of standard base excess. That means if they give you a base excess of say 20, it has to be 10, so the bicarb should be 34. So you calculate that the delta base excess, the delta bicarb and half of the base excess. In metabolic acidosis, the delta bicarb should be standard. For example, you have a base excess of -10. Say you'll see that in ABG, base deficit we call it. So the term is base excess, but it's -10. So if it is simple metabolic acidosis, what should be the bicarb? 14. So you just look at the bicarb. If it is 14, so delta bicarb instead of 24, it's 14. So delta is 10 and standard base excess is 10. That means it's simple metabolic. If it is not 10, then there is some hidden respiratory or metabolic alkalosis. So just by looking at base deficit or base excess, you will be able to know. So once you start practicing it at the bedside, you don't have to look at any other number. Just see whether the patient is acidotic, alkalotic, is it respiratory, is it metabolic, and look at the base excess or deficit. You will know what is this patient is having. It will require some practice, but over time with these steps and the formulae, you should be able to analyze blood gas within a minute or so. This is the Stewart's equation. So I think, so that is where we are. So any questions? So that's on blood gas.